Well, hello and welcome to More to the Story with Molly White. I'm so glad you joined me again today. And again, we have another great episode because we have another great guest on. Before I get started introducing our guest, I want to bring in my awesome, wonderful co-host, Mary Browning.
Thank you, Molly. It's good to be on the show, and I am excited about our guest today too.
I'm excited too, Mary, because it's always great to know and to interview pro-life OB-GYNs, who have been stalwarts really in the medical community because their job, their oath is to save lives and to do everything it takes to save lives, and that includes life in the womb. And we are going to introduce our special guest in just a moment, but we've had a guest on our podcast before representing the American Association of Pro-Life OB-GYNs, and that was the former CEO, Dr. Donna Harrison. And now we have the new CEO, Dr. Christina Francis, is going to be joining us. So welcome to the show, Dr. Christina.
Thank you so much for having me. It's great to be with you today.
Well, we're happy to have you on, Dr. Christina. And like I said, pre-show or earlier, is that it's so rewarding, so comforting, so encouraging to have a strong group of physicians that are pro-life and understand that a pregnant woman is carrying another human being, and that pro-life doctors, pro-life OB-GYNs know that there's two patients that you're treating, not just one. And so won't you, if you don't mind, Dr. Christina, just introducing yourself a little bit about your background and how you got involved with APLOG.
Absolutely. Well, so I'm a board certified OBGYN. I currently live and practice in Northeastern Indiana. I work as an OBGYN hospitalist. So now, in addition to being CEO at APLOG, I take shifts in the hospital where I'm delivering babies, managing high-risk pregnancies, taking care of OBGYN emergencies in the ER, things like that. And I've been doing that for about 20, or I've been an OBGYN for about 20 years. So, and really, what you said about taking care of two patients, that's so true. And that's one of our mottos here at APLOG. And it's actually one of the reasons why I chose the specialty of OBGYN, because it's a really unique and special and exciting challenge to take care of two patients at once. We're the only specialty who does that. And so we really love that. And it's also why I think it's really antithetical to what we do as a specialty to embrace induced abortion, which ends the life of one of our patients. And, of course, we're in medicine to maximize the health of both of our patients, or of every patient that we take care of. So it's a real privilege to be able to do this work. And I was connected with APLOG through Dr. Donna Harrison, who you said has been on your podcast before. Met her. She told me about the organization. We are the largest professional medical organization in the world for life-affirming medical professionals, with just about 8,000 members now, which is really amazing. We've seen really kind of explosive growth over the last several years. And I got involved with the board, became chair of the board, was chair of the board for about 6 years, and then took over as CEO from Donna about 2.5 years ago.
That's incredible. So tell me about some of the work that the American Association of Pro-Life OB-GYNs does.
Absolutely. So, as I said, we're primarily a professional medical organization, which means we exist to represent our members and to equip and encourage them to continue life-affirming practice. And we equip them with the medical evidence that they need from the medical literature to support their practice of life-affirming medicine. So whether that be talking about the humanity of the preborn child and how we know that's the case based on science, or whether it be making the evidence available to them that shows the harms of induced abortion for our female patients, for our maternal patients. Of course, we know induced abortion carries a lot of significant physical as well as mental health harms for our patients. So we primarily exist to support them, and also support them with a network of like-minded professionals, because so many of them so often feel very alone, particularly if they're practicing in very pro-abortion environments. And I think we might get into at some point the fact that many workplaces, many training environments are actively trying to silence pro-life voices within medicine. And so they feel very alone. So we're there to provide a network of support, a real community for them. So that's our primary focus, but additionally, we exist to support patients as well. Patients who either are looking for a pro-life physician or a pro-life medical professional, or patients who may have questions about abortion. And we believe that all women, regardless of the choice they end up making, whether they decide to have an abortion or whether they decide to carry their pregnancy and give their child a chance at life, we believe that all of those women deserve accurate information so that they can make fully informed choices. And so that's another big part of what we do is putting accurate information about abortion into the hands of the public and into the hands of women who desperately need it. And then I guess sort of the third arm of what we do is on the advocacy side. So we do a lot of advocacy work on a state level and federal level, advocating for policies that will support the health and the lives of all of our patients.
Wonderful. That's so good to hear. And I just wanted to come back. We're going to segue a little bit more into the abortion bias in medical training, because you touched on that. But about the accurate information, I mean, I personally believe that withholding information about abortion from an abortion-minded woman should be called medical malpractice. And I remember back in the early 2000s, I worked very hard in Texas on the Women's Right to Know bill, and even worked on creating the handout that's full of information that medical providers, they're not medical providers, about abortion providers must give to women. Of course, they're always trying to find a loophole to avoid doing that.
Right.
But have you seen any kind of legislation or medical efforts or anything in that area about medical malpractice because women aren't given full information about, the risks of abortion?
Yeah, well, you're exactly right. And that, of course, as a woman, I believe that women are intelligent beings and we can make informed decisions, but we can only make those informed decisions when we have all of the appropriate information. And I actually think that it's very paternalistic of abortion providers and of the medical profession in general to think, and this is honestly what people are being told, people who are going through medical training are being told, that if a woman asks for an abortion, essentially you either just need to do it or you need to just give her a referral to the abortion provider if you're not the one doing it, but without really talking about the risks involved with abortion. And so, you're right, that is medical malpractice. And our job as physicians is to give our patients fully accurate information. I do that about everything. Even if I'm recommending a C-section to a woman in labor who I think really needs that C-section, either for her safety or her baby's safety, I still go through all of the potential risks and say, this is not a risk-free procedure. Women who are considering abortion deserve no less than that. They deserve to have accurate information. And you're right, many women, I think, have been duped into abortions because they have not been told the truth about the risks involved with it. And so there are many states I know that have passed informed consent laws that require, and the pushback I've heard against that is, well, that's a part of a doctor's job. Why should we have to legislate that they should be doing? Well, because we know abortion providers aren't doing it. If they were upstanding physicians who were doing everything ethically, well, first of all, they wouldn't be doing abortions. But even if they were, then we wouldn't have to pass laws like that. And, you bring up a good point. There's a lot of medical malpractice that occurs in the abortion context, not just not giving fully informed consent, but many women honestly are butchered by these abortion providers, and they get away with it because they don't manage their own complications. And so, we are seeing more women. I think it's very, very hard for women because of all of the shame and just everything that accompanies that abortion and that abortion experience. I think it's very hard for women to speak up publicly or to file a medical malpractice suit against that abortion provider. Thankfully, we are starting to see more of those occur, as they should. These women deserve justice in these situations. There's a medical malpractice case in Illinois right now involving actually a woman from Indiana, who was badly harmed by the abortion provider. I mean, just one of the grossest cases of medical malpractice I've ever heard of. And thankfully, she is suing him over medical malpractice. So I think that we need more of that to happen, so that these abortion providers will be held to account.
Especially now with the abortion drug, because the complications are happening so quickly.
Yeah.
And so I would encourage our viewers and our listeners, if you or someone has been harmed by the abortion drug and had to be hospitalized, go to the ER or whatever, sue right away. We're here to support you. I'm sure APLOG would be there to support you. But we've got to hold these, I call abortion a predatory industry. I mean, it really is predatory. It exploits pregnant women who are vulnerable, and they're not there to help her. They're there to make money. By causing abortion or producing abortions, seducing people into abortion is what I call it. So I'm off that tangent. We lost Mary. I don't know what happened to her, but we hope she joins us real soon, because I know she had some great questions she wanted to ask. But let's go to right off what I just mentioned earlier, the mifepristone, and what's the other drug? The misoprostol.
Yeah.
Let's talk about the abortion drug. We had Dr. Donna Harrison on here. She explained how it came about, how it came to the United States, how it quickly went through all the FDA approval. It's on the market. Now they're trying to make a generic drug. But let's talk about this dangerous drug that is harming women and killing children left and right.
Yeah, absolutely. Well, this is, if anyone is listening or watching to this podcast and they're not aware of the abortion drugs, they absolutely need to be, because this is how the vast majority of abortions are being done in this country now, are via this 2-drug regimen. And just a very quick overview, that first drug, mifepristone, essentially starves that growing baby to death, cutting off the flow of nutrients and oxygen between mom and baby. And then the woman takes the second drug, misoprostol, essentially to induce labor. And she will go through labor oftentimes on her own, in her home bathroom, in her dorm room.
Walmart bathroom. We've had
exactly. Yeah, exactly. And oftentimes alone and without adequate pain control. I've talked to women who have delivered babies at term and then who'd had chemical abortions via these drugs, who said that it was every bit as much pain as labor was. So this is not an easy process physically. It's not an easy process mentally for women either. They will oftentimes see their baby. They deliver their baby and they will see their baby, and many women are not prepared for that. So the mental health toll that this is taking on women, I don't know that we will ever honestly fully grasp the scope of that. But certainly the physical toll that we're seeing, especially because of the way these drugs are being dispensed. So I'm sure that Dr. Harrison, when she was on, really detailed the negligence of the FDA in removing many of the safeguards around this drug. But now we're at a point where this drug can be dispensed online with no interaction with a medical professional. People can get online, fill out a form, and get these drugs shipped to their home. No screening for how far along they are in their pregnancy, even though we know the complication rates go up the farther along in pregnancy they are. No screening for ectopic pregnancy, which is the leading cause of maternal mortality in this country still. And these drugs will mask the symptoms of a rupturing ectopic pregnancy, delaying crucial care for women. And no screening for coercion. And of course, we are hearing, those of us who were in the know about this issue when this happened said, this is going to be a gift to abusers, that they will be able to get access to these drugs and force them on women who don't want abortions. We were accused of being fear mongers. Of course, now we are hearing story after story after story. There's a lawsuit in Louisiana. A brave woman named Rosalie is speaking out and suing the FDA over the fact that her abusive boyfriend was able to get access to these drugs and force them on her when she wanted to keep her baby. And unfortunately, she lost her baby because of that. So this is what's happening. This is what's been made possible by the FDA. And of course, people on the pro-abortion side claim that these drugs are safer than Tylenol when nothing could be further from the truth. These are dangerous drugs at their baseline, but they're especially dangerous in the way they're being dispensed right now. And in fact, 2 reports came out earlier this year based on insurance claims data that looked at what is the real complication rate in the real world. So not in the sort of controlled environment of a clinical trial, but in the real world, the way these drugs are actually being dispensed now. And the results were eye-opening for a lot of people. Honestly, for me, they weren't, because they're completely consistent with what I'm seeing in my emergency room, which is that nearly 1 in 9 women who take these drugs experience a severe complication. That may be a blood transfusion, it may be an emergency surgery, it may be severe infection, it may be an emergency room visit, which in and of itself is not insignificant. The fact that she had, Tylenol doesn't send 1 in 9 people who take it to the emergency. And in fact, one of my responses to that claim is that they are not safer than Tylenol, because when we see complications with Tylenol, it's from when people overdose on Tylenol. The complications that we're seeing from the abortion drug are when people take the FDA approved dose of the abortion drug, and it still causes these severe rates of complications. And that's just talking about mom, right? That's just talking about the woman who takes them. Of course, these drugs are nearly uniformly lethal for the baby whose life is taken by these drugs. So when we consider safety, we need to consider the safety of all of our patients, not just one. But this is, this really is truly a war on women, and women are being lied to. They're being told that this is easy, that it's safe, that they can do it from the privacy of their own home. And what it's doing is it's depriving them of the medical care that they need and deserve. It's also depriving them of the chance to have abuse screened for and prevented. And it's depriving them, I think, of the follow-up that they deserve as well, because they're not getting any follow-up either.
Oh, geez. Mary, I know you were off there for a little bit, but you want to jump in here and ask a question, because we didn't know where you went.
And my internet went out. That's what happened. I think listening to Dr. Christina, I think the biggest thing that I think I'd like our listeners to know is what you were talking about, how dangerous this is, regardless of what people are saying, how safe and easy and simple, like having a period. And it really is not like that at all for many women. So I thank you, Dr. Christina, for enlightening our listeners and letting them know that this is really, from my perspective, I don't even consider this healthcare.
Well, I know, I'm sorry, Mary, I think she kind of froze up a little bit.
I don't think of them as healthcare.
I know, Dr. Christina, that, the abortion industry is saying that these drugs are safer than Tylenol, but of course there's no research to back that up, and they're trying to compare apples and oranges. Right. And so it's totally misinformation. It's totally, for me, again, a predatory practice. Mm-hmm. And I wanted you, and you talked about the 1 in 9 going into the emergency with severe complications, but does that number reflect even minor complications anytime a woman goes to the emergency room, or is it for just, is that number just on the severe cases?
Right. Yeah. So that study, or that report looked at women who go to the emergency department for abortion related complications that are coded moderate to severe. So it didn't include, let's say a woman took the abortion drugs and then got the flu and went to the emergency department for the flu. Those were all excluded from that report. So these were abortion related complications that required some form of intervention at the emergency department. So, but as you said, even women who don't go to the emergency room will oftentimes have a significant amount of blood loss. They will have severe pain. And, again, I don't think that we can overemphasize the mental health toll that this is taking on women who are not prepared for what they are going to see, what they're going to experience. I have been in talks with a post-abortion care ministry who has seen several women have to be admitted to inpatient psychiatric units after experiencing a chemical abortion because of the mental trauma that it puts them through. It essentially is acute. It's an acute trauma for them. And Yeah. And so,
They're just told it's products of conception.
right,
They're not, like you said, they're not prepared to see their baby. And then when they call, if they call the abortion clinic about what do I do with my baby, they're told to flush it.
right,
So
right.
what's going
Absolutely.
into our system? And even, I was thinking, when all these women taking these drugs, and it's going into our sewer system. I mean, what's the long-term wide rippling effects? And I don't want to get off on a rabbit trail, but we've got to think outside the box here.
Right,
And
right.
so when you're talking about 1 in 9, that is horrendous
Yes,
number. And I
yes.
wanted you to briefly, or not briefly, just take some time to talk about Dr. Kevin Duffy's research in the UK about how many hospitalizations there were from women who've taken these drugs, these
Yeah,
abortion drugs.
absolutely. Absolutely. Well, so out of the UK, there was a report that came out recently that looked at, since their pills by post is what they call it. So it's essentially what we have here in the US now, where the drugs are mailed to a woman without her having an in-person visit with a medical professional. Since their pills by post program went into effect, which I believe was sometime around 2021, 2022, they've had 54,000 hospitalizations. Now, this is in the UK, which is much smaller than the US. And they've had 54,000 hospitalizations. So these are not just women who said, I had a bad experience with my abortion. It was really hard at home. These are women that were sick enough that they required hospitalization. So this is not, it's not safe. It'd be interesting. I don't have the data, but it'd be interesting if we could find out, how many hospitalizations do they have a year from their equivalent of Tylenol, and again, those would be overdoses, but 54,000 is a very large number of women who have been actively harmed. Many of whom were probably told that this is a very safe option for them. And I know at least part of that is from women taking these drugs well beyond the time, here in the US, these drugs are approved by the FDA through 10 weeks of pregnancy. We know starting at about 8 weeks of pregnancy, the rate of complications starts to really exponentially increase. If you look at the curve, it kind of goes like this and then starts shooting up of the number of complications. And so we know that at least a good portion of those complications in the UK are from women taking these drugs well into their second, even their early third trimester, which will lead to a much more significant complication rate. So again, these are not safe, and these numbers are trying to be suppressed by the abortion industry and by their allies within the medical community as well. Unfortunately, the American College of OBGYNs, who claims to be the premier professional organization for OBGYNs, has said that medical visits, a visit with an in-person visit with a medical professional before a woman takes these drugs are medically unnecessary, that ultrasounds are medically unnecessary, that this can be done safely just over the phone or online. And of course, that's not true. And, honestly, I'll just close by saying this. Every time I go down to my emergency room, and mind you, I practice in Indiana, where abortion is largely illegal since we passed our abortion law in 2022. And yet our group is still routinely seeing complications from these drugs in our emergency room, because since these drugs can be dispensed online, it essentially negates every pro-life law across the country, because these pills are being shipped into all 50 states. And every time I go down, one of the emergency room doctors will say to me, here's another one. Even doctors that are pro-choice, are not necessarily with me on the abortion issue, recognize the fact that these drugs are routinely creating complications for women.
Oh, that's so sad. And what I was going to ask about, just lost my question. We were talking about the research. Well, I just want to make a comment. It's so important. Oh, I know what I was going to say. And we lost Mary again, but women are normally about 50% are wrong in their guessing of their gestational stage of pregnancy. I might think I'm 6 weeks along, but I'm really 9 weeks along or 8
Right.
weeks along. So I think, not having a pregnancy test, not having an ultrasound, not having a visit with the doctor to find out exactly how far along you are, then you're more than likely going to be wrong on your gestational age. And the reason why you're taking these drugs thinking you're within that time frame. And then
Absolutely.
that leads to higher complications, like you just mentioned.
Absolutely. And, we were talking about informed consent before. Informed consent means that I, as the physician, talk to the patient about her particular risk for any given surgery or, medication or whatever. You can't possibly give a woman customized informed consent unless you know how far along she is in her pregnancy, because the rate of complications is different if she's 5 weeks versus 12 weeks. And so, really, the only way for a woman to truly receive informed consent is if you know that she doesn't have an ectopic pregnancy. You know that you know exactly how far along she is. And that cannot be done accurately by her just telling you when her last period was. And that's not just pro-lifers saying that. Actually, the American College of OBGYNs, even though they say ultrasounds are medically unnecessary, if you look at another one of their documents that's not talking about abortion, it's talking about women who want to keep their pregnancies, which apparently changes their medical care per ACOG's opinion. They say that, studies show that 40 to 50% of women will be wrong about how far along they are just based on their recollection of their last period. And that any pregnancy that is not dated by an ultrasound should be considered suboptimally dated. So they say that. And yet, when it comes to abortion-minded women, apparently ACOG is okay with them receiving a lesser level of medical care, which I think is horrendous. At AppLog, we believe, like I said before, every woman, regardless of the choice she ultimately ends up making, every woman deserves excellent healthcare, and they deserve accurate information about that healthcare. But that's not what we're seeing from the abortion industry. It's not what we're seeing from abortion-aligned medical groups like the American College of OBGYNs.
Amen. That's why we're called More to the Story, because there's more to the story than what the abortion industry tells you or doesn't tell you.
That's
so
right.
let's close up with this. It's so important that women who have taken this drug know that there is abortion reversal opportunities out there.
Yes.
So let's talk about the abortion reversal drugs.
Yes, absolutely. Well, especially because chemical abortions are becoming so much more common, and because women are really not receiving any counseling now before they order these drugs online. And so the rate of regret is increasing because women aren't being given a chance to talk to somebody about, other options, things like that. And so if a woman takes the first drug, mifepristone, and then changes her mind and wants to save her baby, which we know happens very frequently, there is the miracle, I think, of abortion pill reversal now. And it uses a very basic biochemical principle that all of us who went to medical school learned about, that essentially involves, mifepristone blocks the action of progesterone, which is a key hormone in early pregnancy that helps support that baby until the placenta develops. And then the placenta actually takes over in progesterone production. And that happens at about 12 weeks or so of pregnancy. And so when mifepristone blocks the action of progesterone, that's what leads to that cutting off of the flow of blood between mom and baby. And so what abortion pill reversal does is we give women higher doses of progesterone, the same doses that are used by infertility doctors for patients who have IVF pregnancies or maybe have a history of recurrent miscarriages. So it's not a medication or a dose of a medication that is not routinely used in other areas of obstetrics. And we give the woman progesterone to outcompete, essentially, the mifepristone. So the progesterone sort of fights with the mifepristone to bind at the receptor sites and be able to be effective. And what we know from the data that we have is that close to 70% of women who start this within 72 hours of taking mifepristone before they take that second drug will be able to save their babies. Those numbers might be even higher at this point. More studies are currently being done, but the data that we have right now says close to 70%. Compare that to if a woman took mifepristone and didn't take progesterone, just kind of didn't do anything else. Less than 25% of the time her baby will survive. So progesterone increases the likelihood of her baby surviving from less than 25% up to close to 70%, which is really amazing. But it really is a time-sensitive thing. It needs to be started as soon as possible after she takes mifepristone, and certainly within the first 72 hours. And so, as you said, it's really important for women to know that that's a possibility so that if they regret their decision after taking mifepristone, they can access that care very quickly.
So where would a woman go to get mifepristone?
To get the reversal, to get the
Yes.
progesterone for
Mhm.
reversal?
Yeah, or
Yes, so
where can she look online, or where,
yeah.
where can she go?
Absolutely. So she could access the Abortion Pill Reversal Network by just going to abortionpillreversal.com. Also on our website at aaplog.org, we have a whole page about abortion pill reversal that sort of delves into some of the myths surrounding APR, some of the lies that are told about it. But if a woman is wanting to access the ability to try to reverse her abortion, the best place for her to go is to abortionpillreversal.com. They have a 24-hour hotline that is staffed by trained nurses who will then connect her with a physician or another abortion pill reversal provider in her area that can talk to her, finish the consent process, see if this is something she wants to do. And if so, then we call in the prescription to her pharmacy. If it's in the middle of the night, if it's during business hours and we can get her in right then for an ultrasound, then we bring her in for an ultrasound, do that, and then get her started on progesterone.
Wonderful, wonderful. Well, and our producer just put the website on there, but it's abortion reversal.
Abortionpillreversal.com. Yes.
Abortionpillreversal.com. There it is on the screen. Or we can go to aaplog.org, and there's information on there. And I know there's a lot of helpline numbers that can also make referrals for women who call in regretting that they took the drug, and if they're in that time frame, can seek abortion pill reversal to save that baby. Well, thank you so much, Dr. Christina Francis, for coming on and being our guest today. It was very informative. Time flew by, but I really appreciate your time, and we look forward to having you back on again. And I'm sorry something happened with Mary. She said she was having internet problems. I'm sorry that she was not on very long to jump in on this conversation, but we want to encourage all of our viewers and all of our listeners, get educated on the risks of mifepristone and misoprostol.
Mm-hmm.
I'm always having trouble with those names. Get informed. Don't make rash decisions. If you're pregnant, call one of our helpline numbers and get help. Don't make a rash decision. And if you've taken this drug and regret it, be sure to go to abortionpillreversal.com and get help. Well, thank you again for joining us, and we look forward to seeing you again next time. God bless. Bye-bye.
Hello, friend. Our broadcasting wanted to take a moment to personally thank you for being a listener of the More to the Story podcast. Whether you're a longtime subscriber or just found us, we're so glad you're here. This podcast is a community built on sharing, and that's where you come in. If an episode has ever resonated with you, please consider sharing it. Text it to a friend, post it on social media. Your recommendation is the most powerful way to help these important stories reach new ears. We are also inviting businesses and individuals to partner with us as official sponsors. Sponsoring the podcast is a wonderful way to reach a dedicated, thoughtful audience while directly supporting our mission. If you'd like to explore sponsoring the podcast, we invite you to visit our website at www.moretothestorypodcast.org. Again, that's www.moretothestorypodcast.org. Thank you for being a part of our story.